empowering, enlightening, and intelligent.
Hello, hello, hello. Here we are again. Jeannine LaRue of the LaRuelist Cafe.
I present to you the LaRuelist Cafe.
Let's talk about it. Let's talk about it. We have two amazing guests. I know every time we come on LaRuelist Cafe, I always say we have two amazing guests. We have three amazing guests. Today, come on LaRuelist Cafe, I always say we have two amazing guests. We have three amazing guests. Today, come on LaRuelist Cafe, I always say we have two amazing guests. We have three amazing guests. So what's wrong? Why are we hearing echoes like that? We don't know. Are we still live, Raheem? Yes. So all across the nation, we are beginning to restart and recover our economy in the midst of COVID-19, the pandemic. And one of the things that we are going to find out, everybody keeps saying it's all about testing, testing, testing. They're saying that it's all about contact tracing. And we know that we don't have a vaccine. Right now, there's not really a treatment, but we want to know who has been in contact with whom if we find out that we are positive with COVID-19. So we have two legislators who are coming on here today. They are going to talk about what we're doing in the state of New Jersey to do the contact tracing. We're going to talk about what it will mean to as far as our privacy, how they're discussing this. We do have at least one city in the state of New Jersey who is doing contact tracing. We're going to talk about that city. Just happens to be represented by one of the legislators that we have on here today. And then we're also going to talk about a lot of jobs will be created in this industry when we start with contact tracing. So let's bring on the first guest to say hello, Assemblyman Andrew ZWICKER. Come on through. Thank you for coming, Assemblyman. We are so happy to have you as a part of LaRuelist Cafe today.
Thank you, Jeannine. Thrilled to be here. Very much looking forward to this discussion, and thank you for inviting me. Surely.
And the next one, the part of this great duo today, is Assemblywoman SUMTER, SHAVONDA SUMTER. We're just so happy to have her a part of this operation today with LaRuelist Cafe.
Thank you so much, Jeannine, for having me. And I'm always glad to join my partner, Assemblyman ZWICKER. This is an important topic that we're excited to share with our fans on Facebook Live and YouTube, so we get the information to the people directly.
Yeah, so let's have the two of you on here together. I'm going to ask you if you would tell us a little bit about yourselves. I know that Senator Assemblyman ZWICKER, you are actually over at Princeton University. Tell us, what do you do there?
So I'm a physicist at the Plasma Physics Laboratory, where I'm the head of communications and public outreach there. We're working on creating a new form of electricity that is safe, unlimited, and doesn't pollute. It's the ultimate source of energy. It's something that binds us all together. We try to recreate the core process in the center of the sun in a machine on Earth. It's an exciting, really interesting project to be a part of. And since January of 2016, I've also been a member of the New Jersey General Assembly, representing the 16th Legislative District, which is a central part of the state. And I'm the chair of the Science, Innovation, and Technology Committee.
Now, somewhere I read that are you the first Democrat to have been elected in that district?
I am. So the 16th district, until me, from its entire creation, had been a Republican district. And my background in science is really the reason why I was able to win in November 2015. 34,000 people voted that year in my district, and I won by 78 votes. So wow. Voting really makes a difference, and every vote really does matter.
Well, we've got to make sure that we get that really higher next year. So we're on your team. And I was there that night. It was an exciting night when those votes were counted. So good for you.
I
So,
remember it well.
yep. Assemblywoman,
Yes.
tell us something about your background. I know you're in healthcare.
Yes.
Tell us about what you do.
So for the past 20 years, Janine, I've been in the mental health, behavioral health space. It's important that we take care of our mental wellness, mind, body, and spirit. During this season of COVID, I can't tell you how many wellness tips I've offered to folks to make sure that they're taking care of themselves and taking a break from the news so that they can keep their mind well rested and in good spirits. It's a perfect storm, if you will, when you don't know what tomorrow may bring and you're uncertain about a disease that you can't see and there's no vaccine for. So truly making sure that people know that we're concerned about their mental wellness and making sure that they're getting the help they need.
Yeah, so here we are in the COVID-19 age. My family participated yesterday in one of the big marches in Trenton, and I guess they had well over 1,000 people there. And I have to tell you, while I was so excited to see them be active, I'm a little nervous about the next 2 weeks, about what the statistics are going to look like throughout this country with all of these protests going on. Is there a need, do you think, to be concerned about this?
So from a healthcare standpoint and what we've seen on the front lines, there is a need to be concerned. I am pleased to see that folks are wearing masks. My daughter participated in a march. She's in Albany. I'm pleased to see the passion. Truly, this was the spark in a time period in our country where we were uncertain. So an expression, a positive expression of unity from all races is needed now. You're seeing whites, you're seeing blacks, you're seeing Asians, you're seeing every nationality come together. So that gives me hope of us uniting. I am concerned, of course, about the impact and the spread of coronavirus, but humanity has shown itself strong, and us standing together for the senseless loss of life is important as well. So there's a balance to this.
I couldn't agree more. I think people coming together to raise their voices during one of the most difficult times in recent memory is critically important. Most people were very conscious of being socially distant, covering faces. And I think also all the rallies were outside, which doesn't make it go away, but it does reduce the possibility of transmission. So I share your concern, but I also agree with someone with Sumter that this is just a powerful moment in our country's history, a turning point, we all hope. And so it's just critically important that we balance these two moving forward.
So I would imagine that the two of you are involved in the whole restart recovery process. And I noticed today that the governor now is spelling out the terms for barbershops and beauty salons to open. And I am so glad I'll be able to get something done to my hair, maybe even throw a little color back in it, who knows. But while we're restarting and reopening, we also know testing is going to increase. And as testing increases, there will be a lot more people who are positive. Let's talk about, how do you find out, trace those people that you've been in contact with to find out who else could have been exposed. So the two of you, I think, Assemblyman, I want to talk about this bill that's out there. And then Assemblywoman, I'm going to come back to you to talk about what's actually being done now in Paterson. So tell me, there is a bill that's in the legislature dealing with contact tracing.
And thank you, Jeanine. And on Tuesday, June 9th, both my committee, the Science Committee, and Assemblywoman Sumter's committee, the Community Development Committee, are going to have a joint hearing on this bill. The bill lays out sort of the basic principles of privacy when it comes to contact tracing, because contact tracing can help save lives. And Patterson has shown how to do it effectively. But we have to make sure that as we do that, we don't give up our fundamental right to privacy. And so the bill in simple form simply says, collect the minimal amount of information to save lives for public health, use it only for that, for nothing else. And when you're done with it, delete it. And we need to create a level of trust, because if we don't have people participating in contact tracing, then the possibility of spreading the disease continues. And we know that a certain percentage of people who get this terrible virus are unfortunately going to die. And we have to make sure we are protecting our most vulnerable communities. We have to make sure we're protecting people who are spreading, have the possibility of spreading this. And so that the bill is designed to try to increase trust by protecting privacy.
So, Assemblywoman, you folks are actually doing this in Patterson. Tell me how does that work?
So in Patterson, we are working with our local public health department, which every municipality has. We had the misfortune of having cases of meningitis last year, so we actually had to train local individuals who are community oriented and trusted and are part of the fabric of the community. That piece is important, making sure that you connect with people because you're asking for very sensitive information. So making sure that there's a cultural sensitivity to gathering that information, and also some skill in interviewing the individual and then trust in protecting that very sensitive information. So we added to our local Department of Health's team so that we can gather the information on who's symptomatic. Once we had the testing done, it's important to note that we had to increase our testing capacity so we knew who was symptomatic. When you live in dense communities, we're one of a highly populated community, third largest city in the state of New Jersey, and we live in multi-family dwellings. The impact of COVID-19 has been devastating as far as the loss of life in our community, let alone the state of New Jersey. So we really pivoted quick to make sure that we're able to know who has contracted COVID-19 or the coronavirus, secure that information. Now we're working with the Department of Health and how to synthesize that information so we know what data points we're protecting, and also how to alert every person they've come into contact with for safety, or either create isolation opportunities, because again, we're living in multi-family unit dwellings where sometimes heads of households or entire households have been impacted by the virus and had to quarantine in place. So it's been a challenge, but we're doing a great job with our Department of Health. I was with them on Friday as part of our mayor's task force for the COVID-19, and making sure that we're continuing to communicate and protect our citizens with information.
What about mass transit? I mean, how are you going to deal with finding out if you have a person every day, they catch the bus to go to work? And normally the same people may even be on the bus, or it could be different people. How do you do contact tracing with that?
So I'm pleased that New Jersey Transit has made the step to only have 50% occupancy on the buses. They're also requiring that passengers have a mask. I'm pleased with New Jerseyans because they've been diligent. Wherever you go, you see people with masks on. They're respecting it. Even our children are wearing masks. All important to making sure there's a limitation on the spread. Cleaning, sanitizing vehicles, all important. We've been successful in Patterson with our efforts because at the testing sites, we've been gathering the data and then reporting back to the individual. So it's a sophisticated, basic public health operation where it's person-to-person contact from a trusted source. There's no substitute for that. As much as we use technology, technology is the portal that we're entering the information into. And hopefully we'll get even more sophisticated with the state operation, because while we're 800 person in the state, public health officials and folks working with them in the entire state of over 500 people, we're talking about needing contact tracing tracers, if you will, to the tune of 3,500 people. So you're talking about a massive training of individuals for safety from every portal that there may have been contact, while protecting their rights.
Jobs. You're talking about jobs. Oh my goodness. 3,500?
Yes.
What's the education background? And I'd like to bring the assemblyman back in to talk about this as well. I get excited about jobs because I think some people still think that I work for a governor, which I don't. It's been a long time. So all these folks who are trying to get their unemployment, they're like, well, what are we going to do about new jobs? Talk about these jobs.
So the Rutgers University School of Public Health has taken the lead, and they are worldwide experts on training thousands of people to how do you have these sort of conversations? Because it's one thing to pick up the phone and say, hey, I need you to tell me the people that you've been around over the last days. It's another to do so in a way where you've built trust, you've built up a real dialogue. It's not so easy to just do that. And so having Rutgers lead that effort has been really important. But yeah, we're talking thousands of jobs and paying significant amount of money per
hour. You need
hour.
A degree, or you need, is it license, certification? What's the...
This is a public health emergency. And so you simply need to go through the training that Rutgers University is setting up. Right? If you've done that, then you are ready to go. And at that point, you know, you will work with the state, with the local health officials, and trying to get through this contact tracing, because it again comes back to, if someone tests positively, how do we make sure that they do not infect anybody else? It's scary enough to think about the fact that, you know, you might be positive now and have this horrible virus. And then what is this possibility of infecting your family or your friends or your coworkers? And so making sure people are trained, and yes, making thousands of jobs, and doing it in a way that is very sensitive to this information. And how do we protect that is the key here.
I am wondering, since we know that in some of our communities, especially in our Black and Brown communities, predominantly Black and Brown communities, the rate of infection is very high, and even the mortality is very high. How do we get Black and Brown people to trust a system to give up information of who they were in contact with?
So for us, if I may, and Assemblyman ZWICKER is well aware and very connected to our communities as well, and I thank him for being a partner in this effort. It really is making sure we train people from the community. It really is important that we see Black and Brown people serving as contact tracers, serving as a person who is going to connect with the families and the individuals in a conscientious manner, because it is sensitive information. And we know that it has not always been easy for minorities to communicate and be heard. We know there's disparities. We know that there is a racial thread within the healthcare system that has not always benefited the minority communities, including African Americans, maternal health. We worked on a package of bills to make sure that our voices are being heard. So it's important, and I'm pleased truly with the city of Patterson, because literally we sought out individuals from the community and trained them, and the same has to be done in the state. And that's going to be a big part of what we do as legislators, which is not lawmaking, but making sure that there's a diverse group of tracers that are prepared to hit the streets for our state.
I think that's exactly it. We can train these thousands of people, but if we don't do this in partnership with the community, if we don't do this so that it's not strangers calling you up, but people that you know and that you already have a relationship with, then people are not going to be willing to give up this sort of information. And so I think that's exactly it. It can't just be the quantity of people that we're going to hire.
Right.
It has to be the quality as well. And that's really a difficult challenge, but someone Sumter just got it exactly, there it was. It comes from within the community. And we just put together the foundation and say that we'll put the privacy measures into place, but the community has got to be intimately involved with this.
Well, I'm really hoping that you're reaching out to the right organizations as well. I mean, it's so far, I think the state has done an amazing job, from the governor to the legislators and the mayors of the town. Everybody's been trying to get these numbers down. And when I saw in today's briefing that the governor talked about, it was less than 50 people. What was it? 26 people over the last 24 hours had been reported as having passed away. God rest their souls.
Yes.
But I remember those days when we were hearing 300, and I I couldn't believe it. We're going to have to get this contact tracing right, because either it will end up being a beautiful thing where people want to step up and say, I want to make sure everyone who I have been involved in, I want to make sure that they know that they need to get checked out, or it can become an area of people being very paranoid. And so we've got to get this one right.
I'll
No
also
argument here.
Yeah, I was going to say, we also have to get testing right, so that people feel comfortable in being tested and trust the tests. And then we have to make sure that we have some way, if you test positively, not everybody has an ability to just isolate themselves. I mean, we already know some of our most vulnerable communities are also the ones who are living paycheck to paycheck and can't just say, okay, I'm not going to work for a couple of weeks. So it is contact tracing. It is making sure we get the testing part right. And it's also doing everything we can to protect people, because, we have staggering unemployment right now. People are hurting so much with a loss of income. So we've got to do the entire spectrum, because in the end result, we go back to, we have to save lives.
Right. And I think that leads to, what our governor has been saying about public health is a good economy. Can't do one without the other. The other reality is we are making testing free, because that was the other big detractor for minority communities, finding a prescription just so you can get tested. Drive-through only testing. So working with Department of Health for pop-up testing for highly populated areas. We want to make it convenient for people. We also want them to trust that will get them the information back timely, so that they're not unsuspecting or unknowingly transmitting the virus to individuals in their communities or in their homes, and that they're staying safe. We want to build this out and put the meat on the bone, if you will, with this legislation, so that it's not just a soundbite that's not protecting people, because we did a lot of things emergently in the first 8 weeks of the virus having impact for the right reasons, because as you said, Jeannine, we were losing people by the hundreds where we should have been saving them. And I'm telling you, working in the hospital, it was scary. It was hurtful, and our deepest sympathies to those who lost people untimely or not within. I mean, there's no words. I always get tripped up on this, because it really is emotional to think of the devastation that this has caused for us. So now we're able to think a little bit, to breathe a little bit, and make sure that we have some guidelines to protect folks who may be symptomatic and need to alert other people. And we're being smart as citizens of New Jersey. And if we get this right, because you know how New Jersey is, if we get it right, the rest of the world will follow.
Well, we certainly have some of the best and the brightest, not only in the legislature. I think our governor's doing a great job, but we have some amazing healthcare facilities and higher ed institutions. I mean, it's a wonderful time to be in New Jersey. because we're leaders, and the pharmaceutical world. We're doing now. We do have one question from an individual, and I don't know the answer to this. Those people who are placed on quarantine, but they can't work, but they cannot work from home, their jobs. Is there any kind of compensation for them for the time lost?
Andrew,
So the answer is yes. There has been a pandemic unemployment fund set up exactly for this reason, and I know people have either read the headlines or experienced themselves that it's been a frustrating process. It hasn't gone as smoothly as people had hoped it would be. We also have over 1 million people currently unemployed in New Jersey out of about 9 million people living in the state. So the Department of Labor has been working around the clock to try to get all of this backlog taken care of. But the answer is yes. And if this individual hasn't yet applied for it, he or she should. And if there are any questions, to reach out to either myself or Assemblywoman Sumter. Our staff spends probably the majority of their time over the past weeks helping people get through how do you file for unemployment.
Well said. Nothing I can add to that, but we are compassionate about folks who have contracted and need an income. It's a slow process, but we're told the money will come through. That's the good news. The pot is not empty, but it's very frustrating, and we're happy to elevate the concerns. But it's important that they don't go to work. We passed a sick leave bill, so every little bit helps, and we understand it, but it's important that they take their health serious, as well.
I'll just also add, we've all had conversations with people that are heartbreaking, from the what do I do about a family member who is sick? How do I get in touch with a mom or a grandmother who's in an assisted living facility where we know that this virus has ravaged the communities that are there? And then how do I, pay my bills? How do I help provide food on the table? These have been just heartbreaking conversations that each of us have had over the course of this pandemic.
Yes, I have said goodbye to some relatives for this. I couldn't even go to the service, because it's capped at 10 people. So it really is heartbreaking. I've written the name down of the young lady who asked the question on lost income, and I will send it to both of your chiefs of staff as a follow-up. So thank you so much for coming on. I mean, this has been extremely informative for me. I'm hoping that, we know we have flattened the curve. That's a great thing. I'm hoping that the next phase will not be as harsh as what we just went through. We don't know. I mean, have you heard anything? You have any intel to put on that?
So every pandemic we've both flattened the curve and it's come back. And that's the natural course of a virus. But how much it comes back is completely up to us and our choices that we make over the next months into the fall. Until there is either a cure for the symptoms and a vaccine to stop us from getting sick in the first place, we have to make choices, and those choices will save lives. And so, someone Sumter said it, we have to be smart and caring and thoughtful about how we as a community work together to make sure that this curve, if it pops up at all, it does it in a way that doesn't overwhelm our hospitals and allows us to take care of our neighbors and our friends and our family.
Assemblywoman?
And I would just add that being prayerful, because we do not know, being cautious, physical distancing, it all matters. Wearing your protective equipment, your mask, hand washing, some very basics that have helped to flatten the curve. As much as we want to touch and greet each other with a hug and a kiss, it's safer for that distance. Smile with your eyes, right? So all of the things that we're learning to adapt to, I'm so proud of New Jerseyans, because we have really rose to the occasion, and there's been a lot of trust in our elected officials and in our public health workers to support the effort so that we can beat this coronavirus.
Well, I want to thank you for coming on. This has been so very informative for me. And I would hope that my viewers out there think about what they've said. You know, contact tracing is coming. We're going to find a way to get people to feel comfortable with giving up yet one more piece of information to an entity where we've got to learn how to trust them. And in this age of technology, we've given up so much already anyway, that this is for a worthy cause. I'm going to also ask our folks to please keep those masks on when you're going out and amongst a lot of people. Very simply, stay your distance from everyone, 6 feet or more. Wash your hands. That is so very simple, to just wash your hands. So thank you for coming on to the LaRuelist Cafe. We'll see you again at another time, and I can't wait to get back into the State House with you guys and have some real fun. But until then, I'll see you on the internet. Thank you very much.
Thank you. Take care.
Bye-bye.